On May 11th of this year, 2023, the federal COVID-19 public health emergency declaration ended. The emergency declaration had been in place since early 2020 and gave the federal government flexibility to waive or modify certain requirements in a range of areas, including in Medicare and Medicaid. Mostly, we've moved on from the COVID pandemic, but is it now safe and appropriate to lift the emergency declaration? We asked two people who have been at the center of the pandemic from the start. Dr. Trey Dobson, the Chief Medical Officer at the Southwestern Vermont Medical Center, and Becca Balint, now Vermont's congressional representative in the U.S. Congress, and formerly a state senator from Windham County and the state Senate leader from 2021 to 23. We started with Dr. Dobson, who gave us his assessment of what would be changing.
Well, we are seeing far fewer cases in two ways. One, we're seeing less cases, I guess I should say in three ways, Andrew. We're seeing fewer cases that require hospitalization, and that's generally what people are inquiring about when they ask me about cases. But we also, of course, have outpatient encounters, and those have dropped, as well as another measure we use is the number of staff, our own staff that have COVID that are out. And all three of those have declined. Now, we've been through this infectious disease public health emergency long enough to know that just because something goes down doesn't mean it won't come back up. And likely it will. The cases will ebb and flow as predicted, and as really as people talked about early in the pandemic, that at some point we would reach a time period where we get a steady state, and perhaps in the winter when people are closer together and have other diseases that cause coughing and spread of respiratory viruses, that we'll see increases, and that's what we expect.
So, should people still be mindful of and get booster shots as they become available?
The shots that are available now, whether it's a booster or an initial dose for someone who's not been vaccinated, are the same. And that is this bivalent COVID-19 vaccine. In other words, it is directed at two different types of Omicron variants. That is continued to be in use. It's in use now. And it is recommended for everyone, not just 65 and above. It's recommended that everyone have received one of the doses of that vaccine, regardless of what you've had in the past. What has been made available for those 65 and above is a second dose. So let me just use myself as an example. I'm not 65. I did receive the bivalent booster. Now it's been about 8 months ago that I received it, right when it came out. And I'm not at this point, I'm not eligible, nor do I need another vaccine at this point. This fall, that will be a different story as we make the vaccine available typically as an annual type vaccine. And it also may be changed and modified somewhat to try to match the recent, as you mentioned, variants that are out there. Now, if I was 65 or if I had certain health conditions, even though I've already received one dose of the bivalent, it's been several months, it would be appropriate for me to receive a second dose of the bivalent. Someone might ask why. I just said that everyone's had vaccination and they've had a prior infection, whether they know it or not. They most likely have. Over 90% of people have been exposed to the virus. And the reason why is it offers additional protection against hospitalization. If you are not worried about hospitalization, it still offers additional protection about getting the virus in the first place. So yes, people can still get COVID-19 even though they've been vaccinated or they have seen the virus in the past, but the chances are less. So I don't know about you, but I don't want to miss work or miss a family vacation or miss my kid's sporting event with COVID-19. Even if it's not going to kill me, I just don't want to miss 3 or 4 days of my life if I can prevent it. If I own a business, I don't want my employees getting sick. I want them to be healthy. I want them to enjoy themselves when they're not at work, but I also want them to be available at work. And so the vaccine is a safe way to increase the odds of that occurring. It's the same thing with influenza.
So, in general, then, do you think the ending of the public health emergency at this point is appropriate, or do you still concerned that maybe not out of the woods yet? This is a little premature.
Well, the ending of the public health emergency, as most people know it, it's definitely the right time. I'm certainly in agreement with that because The provisions that were put in place were necessary. And when they're no longer necessary, they become an obstacle, right? So let's just use masks for an example. Some people are now saying, well, we shouldn't have been wearing them in the first place. There's all these studies that say they don't really help. Well, they absolutely helped. They helped when we didn't have vaccine, when we had a virus that was killing so many people. They were necessary. But today, the masks are not as necessary. In certain situations, they should be worn. If you have the disease, you should be wearing a mask if you're out in public. And if you are very susceptible to the disease, you should be wearing a mask when you're around others in public areas. That hasn't changed. But the idea that a physician walking through a hospital or a teacher in a school must wear a mask, or wearing a mask adds much value, that's no longer the case. And that's just the evolution of the virus. There are many provisions that came through the federal declaration that are no longer needed, but there are some that we hope would stay that aren't staying. Some of those are complicated and I'm not an expert on, but have to do with insurance and Medicaid and the Affordable Care Act, and those who are eligible to apply that no longer are. Some of those things were really good for people, and they were worth our federal dollars to support. And unfortunately, those are going away. There are small things that, when someone asks me what's changing in the hospital, to patients, not much. There are small things, though, that have gone away. For example, a hospital system could put in place provisions and facility changes without having to go through regulatory processes during the pandemic. And let me just give an example. I could put in a hospital room a makeshift negative pressure system so that I could help protect patients. Generally, that would need to undergo a lot of regulatory review, and it would need to undergo certain types of inspections. And those things were put to the side so that everyone could respond rapidly. Now, the ability to do that is gone, and that's okay. We should have checks and balances whenever something new is being introduced.
We then turn to Congresswoman Balint for her views on the ending of the emergency declaration. My first question would be, on balance, do you think the timing of this declaration is appropriate or premature? And are you concerned that some of these benefits that went along with the emergency declaration will negatively impact some folks?
Yes, it's a great series of questions. So I will start with, am I concerned that some of these supports are going away? Absolutely. What we have seen during the pandemic and as the numbers of cases have waned and the numbers of deaths have waned, that hasn't meant that people who are facing serious consequences due to lack of food. I mean, that's continuing. And in fact, we were just meeting in caucus the other day here in DC, in Democratic caucus, talking about how alarming it is right now that you have a significant number of folks within the Republican conference that are going after food benefits, going after SNAP benefits, maybe even holding up the farm bill because of that, at a time when we have so many families right now across the country that are food insecure. So absolutely concerned about it. I know that it was not politically possible for us to continue in a state of emergency, given that we're not in the same place that we were years ago. But the need for food supports, the need for help with renter's assistance, the need for supports in Medicaid and Medicare, those continue. And this actually goes to the heart of why it's so challenging right now here in Washington, is we are trying to hold the line on the debt ceiling and making sure we pay our bills, right? And at the same time, knowing, we're going to have to craft a budget this year. We, as Democrats, are not in the majority in the House anymore. We have the majority in the Senate. But those things that you're talking about that are, central to what Vermonters care about and have sent me to Washington to do, they're going to be hard fought this year. And I'm deeply concerned that given not just the state of food insecurity, but just the wealth gap right now in this country is much worse than it was even before the pandemic. And so these issues are going to continue. Another piece that I'm very concerned about is the mental health crisis. I don't know if you've been following all of the data that's been coming out in the last year. You've got 42% of students nationally, school-age kids, who report feeling persistently sad, lonely, disconnected. You've also got almost a quarter of whom have said that they had considered suicide in the last year. You've got a majority of the workforce that is struggling with loneliness and disconnection. So this is also related to the pandemic. It is not because of the pandemic. We saw increasing, an increase in anxiety and depression and persistent loneliness before the pandemic, but it has made it more acute. And I'm absolutely hearing that in every community and in every school that I visit right now. Kids are struggling, faculty, staff are struggling, and parents are too. And this is going to require additional resources. We can't turn away from this right now.
And then finally, I was just sort of a general, broad question. What do you think were the big lessons learned from the pandemic? And if, God forbid, there were to be another similar episode in the next 4 or 5 years, or whenever, what should we have learned from this past experience of the last 3 years or so, that we could put to work to minimize the impact of a future pandemic better than what we did in 2020 and 2021?
I really appreciate this question, because it actually goes to the heart of why I decided to run for office and to represent Vermont in Congress, which is my serious concerns about the democracy and its health. And if we had been in a better place as a democracy, if we still were living in communities where people felt like they could talk with their neighbors, even if they had different political views. I mean, you and I have talked about this before, that exacerbated our problems in the pandemic. You had incredible distrust of government and of science, right? I think we didn't fully anticipate how deep those fractures were. Now we have been given a horrible wake-up call to the tune of, a million deaths, many people struggling with long COVID. But there's also been a real price that we've paid at the local and state and federal level, just in terms of how do we disseminate information to a population, somewhere, between a third and a half of people are not trusting the sources, right? And I'm continuing to see that in the oversight committee that I serve on. There's still a lot of conspiracy theories out there. And so the way that I see of combating that in a real-time way is for each of us to understand that if we are not working to build those ties with our neighbors and within our communities, we're part of the problem, because we can't disseminate information quickly that will save lives. We cannot get support out to people, again, that will save lives and people's livelihood, if what you have is a deep distrust of any kind of government structure. And, it is not lost on me that I serve on committees with people who supported the violent insurrection and who did not vote to certify the election, and who still will not admit that President Biden is our lawful president. They are in the halls of Congress, they're in the House, they're in the Senate. And this is work that we're going to be doing for a generation, because the norms that we used to accept, peaceful transfer of power, that we don't support people that call on the vice president to be executed, basic norms have been completely upended. And so it's a long-term project, and it's not just going to take people like me in Congress taking this on with my colleagues. It's going to take regular Americans saying, I don't want to live like this. And that is something that I've heard a lot in Vermont. I don't want to live like this. I don't want to be so fearful and so angry. And we've got work to do. We do. And what gives me hope is I'm serving in this freshman class with a whole lot of people who care deeply about protecting the democracy, just like I do. And I draw courage and inspiration from them. And I have also been able to make some friendships across the aisle, and going to continue to work on that. But it's challenging because it is clear that the things that we used to accept as not political have become political. And that makes it challenging to come to any kind of agreement on anything. But I remain hopeful because we have to do this work. We don't have a choice. So I might as well be happy fighting the battles.
Again, to highlight the big changes, vaccines will remain available. Access to COVID-19 vaccines will generally not be affected for now. The U.S. government is currently distributing free COVID-19 vaccines to all adults and children. But COVID-19 at-home tests may not be covered by insurance. Insurance providers will no longer be required to waive costs or provide free COVID-19 tests. Medication to prevent severe COVID-19, such as Paxlovid, will remain available for free while supplies last. After that, the price will be determined by the medication manufacturer and your health insurance coverage. You can check with your healthcare provider if you need early treatment to prevent severe COVID-19. And national reporting of COVID-19 may change. It will still allow the CDC, or Centers for Disease Control, local public health officials, and the members of the public to understand COVID-19 dynamics at the community level. For the GNAT-TV News Project, I'm Andrew McKeever.